Good afternoon, everybody. Here we are on a beautiful May day. Appreciate all of you who are joining us to get an update here. I'll very quickly go through the cases, and then I want to talk just a little bit about the news that we made yesterday about the potential reopening of some businesses. I call it sort of a soft opening or an easing into this. But first, let's talk a little about the cases. City of St. Louis, 1,385 cases, 78 deaths. St. Louis County, 3,648 cases, 200 deaths. State of Missouri, almost 9,000 cases, 377 deaths. The numbers from
That's brand new.
the numbers from Dr. Garza and the St. Louis Metropolitan Pandemic Task Force say currently hospitalized, this is yesterday's number, but 654. That's down 31 people. That's some good news. 164 people in ICU, intensive care, ICU, and 112 people on ventilators. That's also down 5 from the day before. 60 people were discharged yesterday. That's good. That's 9 more than the day before. And cumulative COVID patients who have been in the hospital and been discharged, 1,320. So I know that's a lot of numbers. The long and the short of that is that we still believe, Dr. Garza and the Pandemic Task Force still believe that we did hit the peak about a week ago. It has stabilized, gone down a bit. We are looking very heavily at a couple of numbers, which are, I sometimes call them true truths, meaning not subject to sort of interpretation. One is the new hospitalization admissions, people who went into the hospital day by day. And yesterday and the day before were the lowest number of new hospitalizations, just over 30. I'm looking at the chart here, just maybe 32, according to this chart, in each day of people who had to go in the hospital on Monday and Tuesday. So it is trending down a bit. If you want to, for those of you that like these numbers, and I know not everyone does, but if you want to really take a good look at these, look at the St. Louis Metropolitan Pandemic Task Force Facebook page. They do an update every day at 3 o'clock. You can look at yesterday's. Their slides are posted there, and you can really look at their slides. So things are improving, headed in the right direction. We have always said that when we initially began talking about this, we talked a lot about testing, but we all know that we actually don't have as many tests as any of us want. We have more than we did before. A bit of good news here today. The city of St. Louis has had 20,000 tests on order. We've had 2 different orders, but the first one was for 20,000 tests. 13,000 of those tests came in today. Now, they have to be validated, is the word. In other words, Quest Diagnostic, I think, is the one who is doing it today, and we hope to have the results by the end of the day to be sure that these tests are good, because that's not always the case, but they are in the process of testing those now. So we'll either know at the end of the day today or tomorrow, pretty soon. They just got here literally. One of our people sent me a picture of the boxes of these tests. So we ordered 20,000, we got 13,000. We're still hoping for the other 7,000. We also have 200,000 tests on order. They've been on order for a few weeks. And so we're not exactly sure. These tests that we got today, many of them will go to the federally qualified health centers who are doing testing for us around St. Louis, both North and South St. Louis. I've been over those with you before as to where they are, but they are CARE STL Health has several sites. Affinia has several sites. Family Health has a couple of sites. So that's a bit of good news, that we finally did get 13,000 tests. We'll use those pretty quickly, most likely. So that's sort of the statistics here. Yesterday, last evening, County Executive Page and I announced that we are going to begin to ease reopening of businesses on Monday, May the 18th. That's about 12 days from now. Between now and then, we are going to continue to look at these numbers. We hope, sorry, I had to wet my whistle there. That's an old saying. People who are standing here with me are laughing. They don't know what that means. But anyway, so we will continue to look at hospitalizations, at new cases. We expect that we will have an increase in new cases. We're going to have an increase because now we have more tests. So we are expecting an increase in new cases. What it means, though, is that these are the new cases that we've now been able to test. They have probably already been out there, but because of very limited testing, we haven't been able to identify them. So still looking at hospitalizations closely. So what does it mean to reopen businesses on May 18th? That's Monday. It means that we are still going to have some restrictions in place. For example, you will still have to socially distance. This is going to be with us for the foreseeable future. You're going to have to stay 6 feet away from people. You're going to have to wear your masks if you want to continue to be safe. Both of those are extremely important. Of course, you got to wash your hands. You got to use hand sanitizer. You've got to disinfect work surfaces. And I feel a bit like a broken record here because I've said those things so many times, but as we begin to ease back into work, things like cleaning work surfaces is going to become even more important. Masks are going to become more important. We will be requiring employees of businesses that serve the public to wear masks. And we require the employer to provide those masks to their employees. We are strongly recommending that customers wear masks. Now, it doesn't have to be a fancy mask. I don't know if I showed this one to you. Really great company sent me this mask. It's a small company. I'm looking for their name right now. Her name is Nancy. Jacob's going to find who it is. I can't think of it right off the top of my head.
Great Knots.
Great Knots, yes. They usually make bow ties and cummerbunds and that sort of thing. But now they're making masks. So it doesn't have to be a fancy mask like this. It can be a bandana. You can make one out of something you have. But it's pretty important that the public, the customers, wear masks when they go out to shop, go into a store or a restaurant of some kind. It's important to wear masks. It's also important to wear a mask if you're outside, if it's unpredictable about whether or not you're going to be able to stay 6 feet apart. If you're out in your yard, that's fine. We know you don't need a mask there. But if you are out in an open public space where there might be quite a few people, you really should wear a mask. Now, we anticipate that not all businesses will open on the 18th, but I'm speaking restaurants and retail will be able to open on the 18th if they want to. Some aren't going to want to. I've talked to several who have said, I'm going to wait a week or two to see how this goes. I've also talked to many individuals who have said, I'm not quite ready to go back. Now, it's 12 days away. Things change in this environment in 12 days. So we'll be continuing to communicate about that. Dr. Page and I are trying to get on the page, no pun intended, with regard to how we're going to treat various venues. The city of St. Louis actually has some challenges that are not so prevalent in the county because we just have more big venues. So we're working with those large venue folks, whether it be the Arch or the art museum or the zoo, or just big places that we have in the city that aren't prevalent in the county. So we're working with those folks now, trying to figure out what's safe to open and when. So with that, I bet we have some questions, right?
Oh, lots of questions.
Lots of questions.
So Diamond is watching, Mayor. And
hi, Diamond.
Her question is, what happened to waiting 14 days of sustained cases going down?
So what we know that cases is going down, and what it is the new cases identified each day. But we believe that those cases are going to go up because of more testing. So the amount of testing we're able to do is the cases. But it's absolutely true whether someone's in the hospital or not. So that is our pivoting to how many folks are having to go into the hospital, and how many are in ICU and how many are on ventilators, because that really is the best indicator of how many people are really ill. We are still watching this number of cases, and what you see is that, and I don't have it in front of me right now, but the number of cases is also trending down. There is a 7 rolling average of cases trending down. As we more tests probably will not hold.
Missy is watching, Mayor, and Missy's question is, don't you expect hospitalizations to go up because we are testing more and we'll have new cases?
No, not necessarily, because most people who get COVID-19 don't go to the hospital. And whether you've been tested or not doesn't determine whether or not you're sick enough to go to the hospital and get admitted to the hospital. People may be ill at home, and until they get really sick, they don't get a test. So hospitalization is the result of having COVID-19 and testing positive after you get to the hospital.
So lots of questions about service industry, bars, restaurants, massage parlors, hair, nails. When can those sorts of businesses expect further guidance?
So bars and restaurants, we do expect to be able to open the 18th. Hair, nail, pedicures, manicures, tattoo parlors, that's a little bit up in the air right now. But anybody who's in a specific business should go online and look at the CDC recommendations, because we will be heavily relying on what CDC recommends. So bars and restaurants, there's a lot of good information out on the website about what to do before you open, what to do when people come back to work. There's a lot of good information there, and so I would guide you to that. There is also a St. Louis industry group that is working with restaurant owners, our owners, for example, right now, and they have drafted, I don't know if it's quite ready for prime time yet, but they have drafted some suggestions. They're not orders, they're things to help you think through how you might meet the social distancing guidelines. But I know most restaurant operators, they're smart. You know how to get your tables 6 feet apart. You know how to, that kind of thing. CDC guidelines are the most important thing.
Mayor, you mentioned that the city is waiting on an order of 200,000 COVID-19 tests. Mm-hmm. This question is, how can the city reopen if we still are waiting for more tests?
We're going to be waiting for tests, James, for this year until there's a vaccine. We're going to be likely waiting for it. So the day that we've said we're going to ease open, and I do mean this is like a soft opening, folks, that day we will have been under a stay-at-home order for 8 weeks. And we are going to have more tests. We've got more today than we had yesterday, and we'll have more in a week or two, as long as that 200,000 order is a good order. We've been fooled before on that one, but we are going to continue testing, not just now, but probably for the next year.
So on May 18th, just because a business has the ability to begin reopening, there are some questions about whether this is mandatory and if people have the option of taking more time.
it's absolutely not mandatory. In fact, that's why I continue to say this is a soft opening. We're going to ease open. Some folks will be more prepared than others, or more comfortable than others, open on the 18th. Between now and the 18th, these next 12 days, think about where we were 12 days ago, and it's been a lot of progress since then. So no, it's not mandatory. You're just able to open on conditions, and those conditions are masks, social distancing, hand wash, all of the sorts of provisions. We also are going to continue and are continuing to say, for those of you who can work from, you should work from home. This virus is still out there. Just like it is today, it will still be out there 12 days now, just like it was 12 days ago. So once we reopen businesses, it's even more important for everyone to practice social distancing, masks, because then we'll be around more people.
What would you tell an employee? This is, I hope I get your name right, for maybe a Cameo.
Cameo.
An employee who works for a business that's going to reopen, but perhaps they don't feel quite to go back.
Well, I think the best thing to do is to tell your employer. Say that people who have compromised immune systems, who are older, who have underlying medical conditions, probably shouldn't go back to a job where you're interacting with the public. So it all depends on what kind of a job you do. If you get in an office without other people around, and you're wearing a mask, which we all wear masks here all day, except I take mine off to talk to you guys, then it's probably okay. But if you're serving the public, that probably is not a good idea. We're saying people in high-risk groups should continue to stay home as much as possible.
A couple of questions about enforcement after May 8th for employees and people in the public. Who is going to be charged with ensuring that everyone is wearing the PPE businesses and is wearing masks?
Well, the requirement will be, as we're talking about it right now, the requirement will be that those people serving the public, cashiers, that sort of thing, that those people have to wear masks when they're at work. The strong recommendation is that customers also wear masks. We're also considering allowing businesses, and I think this would be within a business's right to decide for themselves. Some businesses might say to you, hey, you can't come in here unless you're wearing a mask. To me, that would make some sense. So who's going to be in charge of enforcing that? The business owners themselves are going to be in charge of making sure their employees serve the public. Maybe not somebody who's working in an office by themselves, but the employees who serve the public have to be wearing masks. And I'm sure the public will weigh in that if that's not the case. Where I go, I mean, I haven't been that many places, but the grocery store and that sort of thing, those folks are all wearing masks, and they're for their safety. And they have this will be a recommendation that there be some kind of plexiglass or some kind of screen between the checker and the customer, or whatever the case is.
Krewson is watching and wants to know what's being done to get federal dollars to help fill the loss of tax revenue that the city's lost so far. And if we don't get help, what kind of cuts or tax increases should we expect?
Jason. So here's a little bit of good news first. Today, we got the wire transfer for $35 million from the state. That came out of the CARES Act. It was passed a few weeks ago by Congress and signed by the president. So we got that money, but the restrictions on that money. That money cannot be used to replace city lost revenue. It can only be used to pay for COVID-related expenses, which are many. They are lots of PPE, a lot of emergency shelter, some construction. There are many expenses. So that 35 million can only be used to reimburse us for direct COVID related expenses. So that still leaves us with really the estimates range from, and I'm talking about now from the middle of March when this started through the end of 21. So that's about 15, 16 months. We're looking at a potential revenue shortfall somewhere between 85 and 125, 26, I think is the number, $1 million. Right now, there's no source of funding to replace that revenue. And so what sort of cuts should you expect? We are working with our federal delegation right now, as is the rest of the country. All governments are in the same for it's called CARES 2 or CARES Act 2, which hasn't been done yet, to provide direct funding to cities and counties and states to cover that lost revenue. Because if they don't allow us to use this funds for lost revenue, we have no other choice but cut expenses. And that means we'll cut services. And for almost all governments, the vast majority of your dollars are spent on people, on personnel, and benefits, health insurance and all that sort of thing. So if we don't get some relief on terms of lost revenue, there'll be pretty major cuts in employees and in services. And we're trying very hard at this point to avoid that.
Kimberly is watching, Mayor, and her question is will City Hall open on May 18th?
That's unclear. I think City Hall, we're developing a plan right now for what will open and when. We can't flood City Hall with visitors on May 18th either. So we are going to continue to strongly encourage to renew their business license, for example, online. You can do it online. You can do it on your phone. Renew your business license online. You really don't need to come into City Hall to do that. Renew your license plates online. Renew your driver's license online. There are some things that you may have to come here for, but I don't see us opening City Hall, fully opening it to the public on the 18th. We've been working over the last few weeks to figure out what it looks like City Hall reopens. There'll be plexi screens between you and between the customer and our employees. There'll be social distancing. Everybody will be 6 feet apart. So, I don't see City Hall fully reopening, or 1520 Market, or any of our buildings. I say City Hall, but I mean all of our buildings fully reopening on the 18th, maybe partially.
Is it possible for St. Louis Police to help city parks?
Yes, it is, and they do. So yes, I don't know what size parties we're talking about here, but any big party, we still have a 10-person social gathering limit, and we will probably continue to have that for a while if you're unable to socially distance and wear a mask. So yes, the police can help break up big parties, and they have.
What happens to the moratorium that the city placed on evictions come May 18th? Will the court extend it?
I think so. I'm trying to remember what the date is right now on evictions, but it's beyond that at this point in time. But we do need to have a moratorium on evictions. People who can't work can't pay their rent. Now, anybody laid off as a result of it should absolutely be filing for unemployment. And that's where you're laid off. Unemployment can even apply to people that are who work for themselves. So you need to apply for unemployment if you haven't already. And I understand, because I talk to a lot of people, that's a struggle. The unemployment offices do it online, by the way, or on the phone. Online is the best. they're busy because thousands and thousands of people are filing for unemployment because thousands and thousands of people have lost their jobs or are unable to work.
Mayor, a question about why you've decided with County Executive Page to softly reopen. Is the economy the only reason?
No, the economy is not the only reason. We've decided because our number of cases, the trajectory is going down. The number of hospitalizations is going down. That's what we've always said we were going to do when we see a sustained decrease. So we made this decision in connection with St. Louis Pandemic Task Force, which is a group of the heads of all the hospitals, as well as Dr. Garza, who, if you can look at their information today, that he does a 3:00 Facebook Live to talk about the information. So we made the decision based on the data, and also on knowing that 8 weeks of a stay-at-home order, we're already losing people to some extent. I don't know about you, but hearing about more people that are ignoring it, and so we need to put some guidelines in place for that, which is the social distancing and the mask wearing.
I'm sorry if you've addressed this, but a follow-up question to your comments about the CARES Act dollars. A question about what are some of your highest priorities for using that federal aid?
So the highest priorities for using the CARES Act dollars are to reimburse us for expenses that we have incurred. So we've incurred a lot of expenses in terms of having more rooms available for homeless individuals. We've incurred in caseworkers and that thing as well. We've incurred a lot of expenses with regard to PPE. We've incurred expenses with regard to some security, and we're going to continue to do that. We have, ordered 200,000 tests. That's a whole lot of money. We have so those are our priorities for the CARES Act money. Now, we do also have some block grant money that is, we don't have it yet, but it's coming in. And that will be helping small businesses get established. That will be rental assistance for folks who can't pay their rent, some level of rental assistance. It'll be utility assistance. So we're using those monies to just help people, but help people stay on their feet.
Will businesses be required to show the city of St. Louis their plan for cleaning, their plan for social distancing, and their plan for masks to the city in order to have to reopen?
Well, I don't think you'd look at every business and what their plan is. So what we're doing is giving them things that they have to do, like social distancing, like masks, hand washing, disinfecting. So there are thousands and thousands of businesses in the city of St. Louis. So reviewing everyone's plan is not practical. Setting guidelines for those folks and referring them to the CDC guidelines is practical. And most of these businesses have employees also. And so between the business owner and the employees, they are the ones that have to implement this.
A couple of questions about City Hall related functions on May or after. The DMVs, are they going to be able to reopen, and can someone take a driver's test? We
don't give driver's tests at a City Hall location ever. We didn't give them before and we don't give them now. Some of the DMV offices in the state may be giving driver's tests. I'm uncertain about that. We could look that up. Whether or not you'll be able to renew your license at City Hall on the 18th, that's still up in the air. That may wait another week or two before we do that, because what happens once we open the DMV office, that is a whole lot of people who come in, and we really are trying to encourage people to do this online. For those people who can't, we want to be able to help them, but if everybody shows up, it'll be a very long wait. So we'll give more guidance later about when the DMV office will open.
So a follow-up question, or a separate question about City Hall related business, for someone who's wanting to come in and pay property taxes, Are there going to be penalties if they're not able to get into the building to do that kind of business?
Well, you can pay your property taxes online, or you can mail us a check. If you're paying your property taxes in cash, you'll have to come in, I guess, because you don't want to leave cash in the mailbox. But try to pay it in some other way. Maybe that's a money order or whatever. Property taxes were due on December 31st. So you're probably already in a situation where if it's May, where you'll already have some interest and penalty because they were 5 months ago.
A couple of people have asked about the status of the casinos in Missouri, Mayor, and when they might be able to reopen.
So the casinos are controlled primarily by the State Gaming Commission, and the Gaming Commission has not made a decision yet on when they will reopen. The hope is that they would all reopen at one time. We don't want to, for Lumiere to have an advantage over Star or Hollywood or the other, but the Gaming Commission will most of that decision. Now we will, and I think the Gaming Commission will also, but we certainly will require social distancing at casinos. They're going to have to work out what are they going to do with table games. If you normally can seat 6 people there, well, then maybe only seat 2 or 3 people there. I know there's some plan to put some plexi, maybe use every slot machine and maybe put some plexi in between it. Those are things that industry is working out. Certainly, I would, if you're in a high risk group, if you're older, if you have underlying medical conditions, I would not suggest that you, run right out to the casino. Casinos probably won't like it if they said that. You're the one who has to take responsibility for your own health. And so just make sure they feel comfortable that you're protected before you go out from your mask and et cetera.
Is the city seeing the number of recoveries rise?
Yes. Number of recoveries is rising. There are people who have had this, who have never been tested, got over it. I have some neighbors who are pretty sure they had it back in February or March, just because of how sick they were with a cold or cold-like. Now, they don't know for sure, but they're covered. They didn't get super sick, thank goodness. But more and more people, I think I mentioned earlier, let's see if I got this number here. I think I do. Of the number of people who have gone into the hospital, 1,320 of them, this is a regional number, 1,320 of them have been discharged from the hospital. So that's good. People do recover.
A couple of questions about whether or not you can address childcare and daycare industry and people who work in those settings come May 18th.
So we are still talking about that. We know that when people go back to work, they need childcare. Some childcare is open now. It's open just for daycare centers, primarily I'm referring to. It's open just for first responders, health workers. So we are talking with those childcare centers. We expect that more will be able to open. There are a lot of CDC guidelines for childcare centers. And for any of you with kids that are thinking about taking them back to daycare or childcare, get online and look up the CDC guidelines for childcare, because there's actually some recommendations in there for parents too, not just for the childcare operator, but also for parents. Get online and take a look at those. Because we know that if you got little kids, most of us have been there, you've got to have childcare if you're going to go to work. So I would say that is definitely something that we have to work out. We've got to work it out with you, and we've got to work it out with the childcare centers.
Going through the final question, Mayor, the city has the transparency bureau page on the COVID-19 expenses. Often, do you foresee that being updated?
Every couple of weeks, maybe every week. I think we recently updated it, didn't we?
I think the last update was through April 12th. It's probably due for a refresher.
Okay. All right. I was thinking that we had updated it, but certainly it is. We are all scrambling right now to just make the decisions and order stuff and get it in. And so it should be updated now if it hasn't already been.
I think that's all the new questions I have, Mayor.
Okay.
For any final thoughts and wrap it up for today.
Well, thank you all. I think, we're entering a period of time, at least 12 days, a period of time where we're going to have another time of rapid change. And thing that we have to remember here is that that change comes with some risk, and we don't want to blow is the best word I can think of, blow the gains that we've made so far. These 8 weeks, by the time we open, it'll be 8 weeks. These 8 weeks have been hard. They've been hard on you if you're staying home. They've been hard on all the workers that are still working, who are working in essential businesses. And we have been successful. We have not seen the number of cases that we feared we might see. In fact, our number of cases have been significantly less than what we thought they would be. And that's a credit to all of you your behavior to try to tamp down the spread. So thank you for that. And so we can't lose sight of the gains that we've made, the success, if you want to consider it that. And I do consider it successful. We have to continue behavior changes and just add a little bit to our behavior. Not this isn't a party. This is easing into back to work, into back to going to a restaurant, going to a store, not grocery store, but shoe store, whatever it is you're dying to go out and buy. So we've got to ease into this, and I know that we'll do this. We're St. Louis. We're good at this. It's not easy. I my Facebook comments. I didn't admit to that, right? I do. I read a lot of them. I don't know if I read them all, but probably not all of them. But I see there's such a divide in our community about folks who want to stay home until we get a vaccine. That would be another year. I don't think we're going to be able to do that. And then folks who never wanted us to close businesses in the first place. So those are the most vocal two extremes, but most of us, I believe, are somewhere in the middle, knowing that, all right, we've got to go back to work a little, we've got to socially distance, we've got to wear masks, we've got to do this in such a way that we can continue to see the benefit of the behavior changes that we've had for the last soon to be 8 weeks. So thank you all for that, and really appreciate everyone's patience and appreciate your thoughtfulness about how you're going to act, conduct yourself, your family, when we're able to go out a little bit more. So thank you for that.